Each year, about 3 million people report a sensation that they've never had before. It can be unnerving and scary. It is vertigo, and a sudden movement can cause the world to start spinning.
But sometimes a simple cure can work. 7's on call with Dr. Jay Adlersberg. Jay?
Bill, Diana, there are different kinds of vertigo. A few people might be familiar with alcohol-induced vertigo, where when a person lies down, the room starts to spin. The feeling is the same in positional vertigo, and a lot of us, around 1 in 20, will experience it at some point in our lives. It can happen when someone bends over. The room suddenly spins, seemingly for no reason. George Rio is now getting a treatment for it.
You okay?
A little lightheaded.
Just lightheaded. I'm coming back up.
He's been having these spells for a while.
One day where I wanted to sleep and I rolled over to hit the alarm clock. And when I rolled back, everything was just spinning, spinning, spinning. That was the worst one I ever had.
That spinning problem is called benign positional vertigo, says Dr. Martin Gitze. He's a neurologist at the New Jersey Neuroscience Institute in Edison. Today he's putting George through some simple head maneuvers, which will most likely clear up the condition.
It absolutely works. It resolves the symptoms in anywhere from 1 to 4 applications in over 95% of patients.
In fact, the American Academy of Neurologists, to which Dr. Gitze belongs, has just issued guidelines endorsing this maneuver to deal with the vertigo, which originates with crystals in the inner ear.
Naturally occurring crystals in the inner ear that get into the wrong place.
Dr. Philip Kramer has worked up a computer model of the face with colored ear channels to show us the problem. The crystals should be sticking to membrane surfaces, but fall out. And it's only by maneuvering the head that they can be delivered back to their original site.
And then to the right.
Dr. Gitze says it's one of the few problems most neurologists don't mind identifying.
This is terrific. It's good for the patient because it's curable, and it is benign in the sense that it's not related to a tumor or a stroke, and it's great for the physician because it's one of those rare situations that you can actually cure somebody right there in the office.
That feels good.
It's not known why the microscopic crystals get loose in the first place. Sometimes a bump on the head could loosen them, and then vertigo shows up years later. It may also recur later in life. By the way, this type of vertigo is easy to diagnose, but other types have to be checked out, as vertigo may be a symptom of a more serious illness.
Immediate gratification. Good for doctor and patient, right?
That's right.
Okay.
That's right.
Thanks, Jay.
Thanks, Jay.
Good morning, 5:44. Vertigo sounds like a fancy word to some people for a little dizziness, a relatively minor problem.
But vertigo can be a terrible, disabling problem. Now there's a simple, non-invasive treatment that can cure most vertigo, and that's what Dr. Max Gomez is here to tell us about. Good morning.
Good news for dizzy people here today. Vertigo is a big problem. About 3 million new cases a year. That means as many as 5% of us will suffer the symptoms sometime during our lives. Now the American Academy of Neurology has issued new guidelines that recommend a simple 2-minute procedure that can cure the most common and often most severe form of vertigo.
And now we're going to turn you so you're facing the ground.
It looks a bit odd, but this series of maneuvers may just be the solution to a problem that's been plaguing Mildred Boxer for nearly 8 years.
I find that when I want to make a cake and the mix master is going around, I have to turn my head because I feel I'm going to go along with it.
You get that sort of
Yes,
dizzy.
I do.
Turns out Mildred's vertigo is caused by a problem in these tiny loops in the inner ear called the semicircular canals. Seems that sometimes little crystals in this organ of balance get into the canals where they don't belong.
The crystal falls through the canal and causes the fluid to swirl, making you feel as if you were spinning.
Experts say the diagnosis of what's known as benign positional vertigo can be made without so much as an X-ray or brain scan, by watching the patient's eyes.
We lay the patient down, and then as he begins to get dizzy, he gets a torsional movement of his eye right there, and then an upbeating movement of his eye.
The solution is as simple as letting gravity do its thing with a little bit of help. Manipulating the head in a series of positions allows the misplaced crystals to work their way out of the canals where they're causing the vertigo. It only takes a minute or so and cures about 80% of vertigo patients.
It it can resolve their symptoms in anywhere from 1 to 4 applications of that maneuver, which you could do on sequential days or separated by a few days, and they are cured for the time being.
If the errant crystals cause trouble later on, the maneuver can be repeated as often as needed. Good news for Mildred.
So when you have the maneuver, it does take care of it? Or
Absolutely. Absolutely.
Now, while this benign positional vertigo is the most common cause of vertigo, vertigo can also be caused by a stroke or brain tumor, which is fortunately much rarer. But that's why it's important to get the right diagnosis, which again can be made by looking for those characteristic eye movements when the head is placed in that so-called dizzy position. You put them in a certain position, the eye movements start making that characteristic almost kind of spinning around, and then you know that it's this benign positional vertigo.
I feel so bad for people who do suffer from vertigo. I've had it once. It's just terrible.
It's awful. I mean, it can make you nauseous, room spins. It can really be disabling. It's terrible.
Yeah, I feel ill right now.
Yeah.
So
just talking about
thinking about it.
Dr. Max, thank you.
You bet.